Do you want to say goodbye to the nasogenian furrow? Stick around and I'll show you the best techniques to eliminate it. Let's go with the first massage to say goodbye to the nasogenian furrow. To achieve a more youthful appearance, we must consider various strategies. Where should we begin? One option is to incorporate argan oil or any type of oil. However, in this particular scenario, perhaps it is unnecessary for me to use it. After all, my skin is already very clean. No problem. Okay, how am I going to do it? Well, look, I'm going to put the palms of my hands here, okay, just below the bone there, and especially this part, okay? Not so much the whole palm, but this part. Important. That's it. Okay. I place. I can even place myself here. And from here, I'm going to pull up towards the temples. Okay? I repeat. How many times, Ruben? 10 times. Upwards. As you can see, the massage I'm doing is deep to eliminate a little bit of the depth that sometimes have those grooves, okay? And it's also going to mobilize it, okay? So here upwards 10 times. When is it better? In the morning and at night. That's it. In addition, with this massage that we are doing, we are also going to elevate the cheekbones. And pay attention because there is also a video to elevate the cheekbones. So we are going to watch it a little bit. Second massage that we are going to do. Well, look, we are going to do a little bit of pinching. Pinching is always careful not to hurt your cheeks, right? That's clear, isn't it? It's clear that's the way it is. That's perfect. We're going to do it gently and repetitively first, okay? And we're going to start from here, from the nose all the way down, okay? Up to the congestion of the lips following the whole anesogenic sulcus. That's the first one. So now notice, we're going to do it here. I'm going to stand here so you can see it well, okay? We start up here with these two little fingers, right there. Be smooth and steady. Keep these two words soft and constant. That would be it. How long do we have to stay? Well, 1 or 2 minutes. From top to bottom. Okay? And now, if we do it both at the same time, okay? That would be here. When you're about a minute in, hey, how long is a minute? Well, look, more or less, if you do it, come on, about a minute, You can do it 50, 40, or 50 times. You've already been doing it for a minute. After that, well, the next one would be, after a minute, do it faster and a little bit stronger, right? Or we fish a little bit more, we catch a little bit more, right? Of skin, and stretch a little bit more. Faster. In this case, it's not so soft. And we stretch a little bit more. And the pediscus a little bit more outward. Okay? This is going to stimulate, the collagen, right? And also the elasticity too of the skin. So super second exercise. The anansogenic sulcus, the line that goes from the side of the nose to the lip commission, formed by the loss of firmness and elasticity of the skin, maybe deeper on one side of the face due to factors such as sleeping posture, predominance of one side when chewing, or muscle symmetry. These exercises and points are the best mix to say goodbye to the anansogenian furrow. Notice that I have left a little bit of a mark because I have been working well, So you can feel that too, right? Not pain, but you can feel that sensation, As if I were vibrating a little bit inside, right? That feeling that you are like this, right? That's important. Let's go to the third one. The third one is very simple, very easy, okay? It's a resistance exercise. So what it's going to cause is that we will have more strength in this musculature, right? It's like this. Let's fill it up. Have you ever inflated balloons, I guess? Well, that's what we're going to do. We inflate, okay? Notice that we inflate everything. And we're going to cover our mouths. And then we're going to do, above all, we are going to emphasize the upper part, this part of the lips, okay? I'll show it to you so you can see it because I'm not going to be able to talk, Well then, To accomplish this, I blow air into my mouth and then attempt to release it while covering my mouth. As a result, the air accumulates in this area. Allow me to restate this concept. Wow, and let it go, okay? So we tone up the muscles. Now let's move on to the stitches. Let's go to the first point. Which one is bundled? ED18, or hollow of the cheek. Which one is bundled? I didn't get confused. It's well said, right? Okay, perfect. You look for it and not that way. Then look where it is, eh? Look, the eye ends, right? Like the corner of the eye a little bit. I drop my finger. After the bone, right? Give it a little bit if you squeeze. So be careful not to squeeze too much. It hurts. It's a good point, it hurts, but it hurts a little bit. On both sides, of course, right? Well, how do you do it? We're here. What we're going to try to do is stretch it out, okay? I mean, towards the sides, towards the ears, okay? We have the point, but we're going to help ourselves with this finger as well, so that it doesn't overlap. And where are we going to place it? Well, right there, okay? Right in the groove, and this way we pull it a little bit, right? I pull a little bit, loosen, pull a little bit, pull a little bit, release. We do this about 10 times, okay? And then we start massaging in this part outwards, okay? Once you've also worked the groove area. So what we're going to do is we're going to give a little bit more muscle tone and elasticity to the skin. So that's Qualiao. Second point we're going to do. And last, the eye bend. Yin Yang, or I truly appreciate the fragrance of axial-like scents, you know? It's something I really enjoy, and it's quite effective too. Why? Because it performs exceptionally well in this particular area. And if I start working here, the muscle is going to have repercussions in the whole groove. So how do we find it? If you don't know, we put little fingers here, nose flaps. Okay? First inward and then outward, and there we have it. Okay? You have to put a little pressure on it. Hey, it hurts a little bit. It doesn't have to hurt, but it has to hurt. My recommendation, if at that moment you hear that you say, look, I'm going to do it because it's at night, or I'm going to do it in the morning, but I have a little while before I go out, okay? Stick your fingernail in a little bit so you can feel the sensation a little bit, okay? It would be here. Stick your fingernail in a little bit there and start pulling upwards, okay? Like you're angry. A little bit there, and then I start turning. Right there. Okay? This way what we're doing is also pulling. There, okay? And we're already working the groove. Okay? This is on the initial lymphatic chain, specifically on improving drainage methods. Look, we are going to place the fingers that you already know are from Star Trek. Okay? We start here and go a little upwards. You don't need to place this finger here. Put it comfortably. We are going to start stretching here. Be careful not to lift the skin. That is, don't move the skin to one side, okay? In place. We're going to do this about 10 times. It's a preparation for the massage. Here and then we go to the neck, okay? We go to the neck, place the palms. And here, okay? Without lifting the hands. Stretching 10 times, and we're already on the second one. Second massage we're going to do, we're going to continue on this part, okay? And we're going to do it with a little bit of oil. Put a little bit of oil on your fingers, especially these two fingers are the ones that will work in this case. All right, and we're going to start. We start here, okay? In the tragus area, that is approximately in the middle of the ear starting area, okay? And we're going to go down here. Start by moving down from the neck, and once we reach this position, move towards the chin and trace along the contour of the jawline. Above the bone. Here. Okay? Go back. And we go down. Keep going a little. We repeat it again, okay? Here. Remember, it's for relaxing, and the movement has to be smooth but also firm. Open, that is, press a little. and relax when you lower the neck. Okay? That would be the second massage. Let's move to the third. Let's go with the third massage. And also mention that this Tanaka massage is not an ancient oriental massage. It's a massage from the 80s, so it's not that old. And it was invented by Yuko Tanaka, hence the name Tanaka for the massage. And it is based on acupressure. That is, all the areas we work on are because there are points there too, and they also have muscle stimulation. That's why it is done in a firm and slightly deep manner. Let's move on to the third massage now then, for the nasolabial fold. Nasolabial fold, if you remember, are these lines that appear here. Where are we going to do it? Well, we are going to place ourselves on the line at the bottom part. They start here, right? And they end here, so we are going to start from the bottom, and what we are going to try to do is move upwards. Look, we start with one finger, okay? With a little bit of oil on each finger, and we work. As if trying to move upwards. And we are going to do this, normally I tell you 10 times, right? Well, we are going to do this 20, and we are going to include afterwards, when you already have the site, the 2 fingers. What are we trying to do with this? Lift and raise deep but gentle the massage. And this would be the third massage. Let's move on to the fourth. Fourth Tanaka massage. Facial tone for me is my favorite because we are going to work on this whole part and also the forehead. So we are going to go with 3 little steps. Remember, 2 fingers are essential to work, these 2. If needed, let's mix the ingredients, including a small amount of oil for added precaution. And how are we going to start? Well, look, we are going to start in the cheek area here, okay? Almost right next to the nose, at the hollow of the nose, we start here. In fact, it's an acupressure point that also slightly releases the sensation of being able to breathe better, so we are working on 2 little things, okay? Put this finger too, and notice, firm, a little deep as this massage is. We follow the lines of the bones. And here, okay? Notice how smooth and relaxing it is. We go back again. Your face almost guides you. It's very easy to do the exercise. There. And lifting it, we're going to do it 10 times, okay? First, obviously we're going to tone the whole area, relax, recruit the muscles, and activate them as well. It becomes even more perfect and feels looser, creating a greater sense of relaxation. Second, what are we going to do? Always 2 little fingers here, notice. We're going to open as if we wanted to bring out the smile, okay? Reaching almost to the end. Here, the lower fingers are very important, right? Apply slight pressure as you approach the conclusion with caution, yet insist on pressing. And here, press the upper ones. Okay? When you finish the lips, press more with the lower ones and go all the way to the ear. 10 times, we repeat this last one, okay? Come on, follow me there. That's it. And the third, and not least important, on the forehead, okay? First, we start with 2 fingers. Make sure you know here, in the middle, okay? We stretch. Okay? To the temples. And when you are clear about where we are and what we are doing, the 4 little fingers, a little oil on each one to help you. If not, you need, take more. And we stretch. See how well? Stretching. Relaxing. That's it. And this would also be 10 times, so 30, right? Always do this exercise in the morning, and now let's move on to the last one. 5th and last massage we're going to do, look, with the palms of the hands, right? We're going to release and finish relaxing this whole area. Look, place it here, as if you were looking at me right now from your home, okay? We place it here, and we stretch. Okay? Here. Backwards. Okay? We return. Here and again. We enter. We stretch. Here we press a little more. Let it drop and again, okay? 10 times this. Still here, simply to complete the Tanaka massage and help you relax further. Which of course, I tell you, is wonderful. If you have any questions, write to me. And as always, to healing and beyond.